with the United Way of Greater Newark on both the community fund to respond to the COVID pandemic, as well as a small business fund. The mayor will be announcing tomorrow that the city is investing $2 million of public funds in a fund to support small businesses impacted by the COVID-19 pandemic. Grants will be available of up to $15,000. The United Way is also supporting that fund.
Mayor Baraka.
Oh, and Mayor Baraka is on. So, Mayor, you have the Newark funding community on the line and on webinar. So I'll just let you give a general update on what's happening in the city and ways that you feel our funding community can plug in. I was just talking about our general fund as well as the small business fund, but I'll let you take it from here. Thank you for joining us.
Yeah, thank you, Kevin. We right now we have about 72 cases in the city of Newark now, with 2 deaths, both gentlemen in their 30s. We at this point, as you know, we have 3 areas where the whole city is under the governor's basically shelter in place, kind of quasi shelter in place order. And we have we have 3 hotspots that we've declared that we're probably going to, by the end of the day, expand very, very in a large way based on the numbers that we're getting. We're going to expand those, and our shelter-in-place order is just a little bit more strict than what the state is asking, and that's what we're doing. We've secured the Indigo Hotel for residents without addresses to quarantine those folks who we have found out may have a fever, may be symptomatic, to quarantine them in there, and those who have been tested and are positively ID'd for having coronavirus. So we're going to have a place for asymptomatic folks who have been positively ID'd, and symptomatic folks who may not have been tested but also have the symptoms. So we're going to be using the Indigo Hotel for that. We're working on another hotel in Newark now as we speak. We have a team that's going to go out starting this evening, because they just got fitted completely, to go out and begin to move folks from off the street into the shelters. The shelters have been taking a few people. We're sending them a letter today to tell them they can't let people out, or they shouldn't let people out. They shouldn't throw them out at 8 o'clock, I should say, not can't. They shouldn't throw them out at 8 o'clock. And we have to figure out a way to get them food while they're in those shelters. But we're asking that they keep them in the shelter until further notice. Obviously, if they walk out, they can't stop them, but we want them not to throw them out. That's it on that end. We're also beginning to deliver food to seniors and to families that need it. Kevin and United Way has been helping us hold the funds for that, and we are going to deliver food starting today in every ward. We also have breakfast and lunch sites open in 16 locations. We feed almost 3,000 kids a day in those sites at Newark Public Schools. They come in and go there. The numbers have been down last couple of days because of the hotspot order that I put on to about 2,000. But usually about 3,000 or more kids go there, and we feed them breakfast and lunch. I know there's something I'm missing, but
Mayor, did you want to talk about the small business fund?
Right, exactly. We are putting together a small business fund. The city is first seeding the money. We also have some money from Prudential Financial that we want to add to that. We are going to target businesses that have 10 employees or less, brick and mortar businesses in the city that have been hit hard by the coronavirus lockdown or shutdown, loss of revenue. We also want to create a fund for hourly workers who have lost wages as well. Whether you're talking about bartenders or people that waitresses and folks like that, people who clean up buildings and that nature. We want those hourly wage workers that we have in the city. Want to create a fund for them as well. We have a 3 o'clock call to button some of that stuff up. We're probably going to be announcing some of it tomorrow. We're having a call on Friday with the congressional delegation, the Senator Booker, probably Senator Hernandez, our folks, and a bunch of the small businesses in the area, trying to attach them to our fund in Newark, but also to state funds and federal funds as well. So that call will be from 11 to 4 on Friday, a webinar that we're doing. That's about it. If I can think of anything else as we go, you have any questions, I'll probably think of some more stuff.
Mayor, this is Maria Viscarando. Thank you so much for that update. Question, when you have that meeting with the congressional delegation, would you mind putting in a plug for nonprofit organizations also being included in any of the relief funds that may be created? Right now, we are really working hard to try to get the federal government or the Senate to look at that inclusively, because obviously nonprofits are a major employer in not only the city of Newark, but in the state of New Jersey. So just hoping you put in a plug for the nonprofits.
Yes, absolutely.
Does anyone else have any questions? You could feel free to type them in the comment box. I'm looking at that. Or if it's easier, you could just unmute yourself and ask the question at this point.
Kevin, this is Margaret Lorenzi from the Community Foundation. Mayor, thank you so much for getting on the call. I'm sure your time is very precious. I have a question about the now 2,000 kids being served at 16 lunch sites, breakfast and lunch sites. That sounds like a very low number compared to what the number of kids that usually would be getting school breakfast and lunch. And I'm just wondering if the pivot that's going to get those families, those children fed, closer to home, given the hotspot order.
It is. We have 16 locations around the city. The parents, obviously, the good thing is they've been listening to what we've been asking them. The other side of it is they're not sending their kids to get the food, which is why we're doing the food distribution program that we're going to start delivering. When people call, we're going to deliver food to their homes, seniors and families that need it. That's probably something we need people to help us with, but we're going to deliver food to people's homes.
Yeah, and I would just, this is Kevin, I would just highlight that that is something we are speaking to foundations about now and working with Catherine on. So that is something the mayor is prioritizing, getting as much funding in as possible to support food to homes, whether it's with ShopRite or looking at other sources. So that's something that we could definitely use additional support for if folks are interested in specifically supporting food. And you can reach out to me separately to talk about the logistics of that and what that looks like.
Mr. Mayor, this is Marsha Atkins from the Healthcare Foundation of New Jersey. Thank you for being with us this morning. Kevin just mentioned ShopRite, and I had heard on the news that one of the employees at ShopRite tested positive. Can you talk to us about what they're doing to make sure that consumers are safe?
Yeah, it's an employee. He's from, he lives in another municipality. He was a front office kind of manager there, so he didn't have really contact with the food. All the other employees that he was in contact with have been quarantined since then. We talked to them. They cleaned up the property 3 times after that. We are now discussing with them following the social distancing rules. ShopRite all over the state has not been in compliance with that. They're just letting people, all over the store. So we've been talking to them about that as well, and trying to get them to support and help some of these initiatives in the city, seeing that they are the one that's open the most and they're making the most revenue out of this thing.
Great. Thank you very much.
Yep.
Mayor, this is Kevin. We're getting a couple questions in the chat specifically about water filter replacements. I know that the communications office and the policy office are working on getting some specific communications out around water during this time, but are there any updates?
They're still doing that. They still, everything that's happening with water is still in place. Those employees are still working. What people can do is help us get them some PPE. Those people have not stopped working. People get calls. They're still doing that. They're still replacing water main breaks. They're still changing lead service lines. They're still replacing filters. They're at work doing that stuff right now. And, they need protective gear when they go do these things, but that's what they're doing.
Thank you. Are there any other questions? Okay, so Mayor, thank you so much for your time. I just want to again highlight that we are actively seeking support in the United Way Fund. Much of what the mayor talked about today can be supported through funds to the United Way Community Corporation Fund, as well as if other folks are interested in the business angle, a business fund, a small business fund, which will also be housed at the United Way. Again, the city is putting in public dollars. And we are hoping to identify some match to support some of the small businesses in the city. So those are the two things that I know are very important to the mayor. And as he said, particularly getting food to as many residents as possible.
Yep.
Mayor, anything else?
Thank you.
Otherwise, we can. All right. Thank you so much, Mayor. We appreciate you joining us.
All right.
Okay, so, and we can have time for discussion towards the end, but I do want to get to a couple of our other guests. We wanted to hear from our nonprofit partners to hear about what's happening on the ground. And so we are joined by two of those partners. The first one we're going to have speak is Victoria Hernandez from the Ironbound Community Corporation about what she is seeing. I asked her specifically, obviously, to talk about what she's seeing on the ground, but then also particular challenges with the undocumented community. So Vicky, if you are on, the floor is yours to give us a presentation and an update on what you're seeing. Do we have Vicky?
She may be on mute.
Yeah, you
Are
might
you
be
on?
muted, Vicky.
Was that you, Vicky? Okay, well, maybe what we could do is move to Amina. I believe Amina is on while we see if Vicky is on and she's having trouble or she wasn't able to call in, we could check in with her. Amina, are you there? I know Amina was on because she was on early. Oh, she's asking, how does Amina?
Does everyone know that it's *66 to unmute?
Oh, it's *6 to unmute, Amina.
Okay, can you hear me now?
Yes, thank you.
Okay, I'm sorry.
Okay, everyone. So this is Amina Bay. I think most of you know her from her work at the city, but she's now Executive Director of the Newark Emergency Services for Families, and she can give us an update from what she's seeing. Thanks, Amina, for joining us.
Oh, you're welcome. You're welcome. So it's a couple of things that's going on here. The first thing that I wanted to mention is I know that there's been a moratorium put out on foreclosures, evictions, utility shutoffs, but it is not being followed. You know, we do emergency services, rapid rehousing here. We have landlords that are not accepting the promissory notes for us because, you know, we've had to do suspend, you know, some of our services. We've been focusing on food, and we've been processing these payments, things of that nature. People are still being threatened to be put out of their homes, to be evicted. They are not paying attention, and I think part of it is because they know that everyone is so engrossed and engaged in the healthcare part of this crisis that they figure that by the time that they're, you know, court, they can't be dragged into court because court is closed. So the residents that we're seeing are really desperate because they feel like they have no recourse and that the landlords are really not adhering to that. So that is something that we've been working with and need some help with, to be honest with you, from the city, from the county, and from the state. The other thing has been the food. I heard the question earlier about the low number of people that are, their children are going to food stations to get food, and we are being inundated. Our lines have been down the street and around the corner for food packages, and a lot of people are picking up for homebound seniors and disabled, and we don't have the ability to really deliver, and so I want to know if there's any type of check-in and check-up on the seniors and the disabled population who are really not able to move about and not even able to come down and pick up free food packages. So these are some of the things that we've been working with. We have completely depleted our pantry. All of our food is gone. We've gotten in some donations. But even once this is over, to be able to restock, to rebuild, to get back on our feet is going to take money that we really don't have. And so we're trying to find out where are these resources and where our help will come from.
Thank you, Amina. If folks have questions, you can type them in the box, or you could unmute yourself to ask the question now, whatever is easiest. I also believe that we have Vicky now. I got an email from her. Vicky, do we have you now on the line?
Can you hear me?
Yes, we can hear you.
Okay.
So maybe
Great.
what we'll do is, Vicky, we can have you speak too, and then we can have folks, ask questions that might apply to both of you or one of you. But why don't you go ahead and give us a little bit of an update from your lens?
Sure. Thank you. So as you know, Ironbound Community Corporation serves the East Ward. I think we're experiencing a lot of what Amina is experiencing as well, and in her community, the immediate needs that are surfacing really are, requests for food, right? Most people shop for the week, and so their week's worth of supplies are running low. We're getting a lot of requests for assistance in filing for unemployment, applying for food stamps and health insurance. People who are already worried about being able to pay their April rent because of layoffs that have happened. In our community, the biggest concern that we have right now is really for the undocumented community. We have a fair number of individuals who are undocumented in our community who won't be able to access sort of the typical resources. They're already sufficiently scared to tap into those resources, and we're concerned that they won't have access to the funding that's needed for them to be able to stay on their feet. So that's a lot of what we're getting. We're also getting calls from individuals who continue to work. They're essential employees, but are concerned about remaining on their jobs and being unprotected in those jobs. So those are some of the other calls that we're getting. And the other concern that we have right now is that many individuals are showing symptoms, but they're not getting tested, right? And so they're calling the FQHC or they're calling the hospital, but because the severity of their symptoms are not severe enough, or they're not meeting the other criteria around whether or not confirming whether they've been in contact with somebody who has a confirmed case of coronavirus, or that they've traveled abroad, they simply are not being tested. And so that's a major concern, right? That they don't have access to those tests, that people are following the protocols that they're being asked to do in terms of calling in, but they simply don't have access to those tests. And my concern is also that there may be state testing sites that are opening up in Bergen County, and that
the Arts Center down in Homedale, but we have a community of people that, you know, can't travel, right? They can't just hop in their car for the most part and get to those places. So we're really, you know, concerned about the spread of this virus in our community, just given the fact that folks can't really get tested and confirm that they have it. Our organization has pivoted pretty quickly. We're already trying to figure out how we can provide food resources to our families, primarily our Head Start families, because that's where we're seeing the most urgent need. As I mentioned before, we're beginning to provide assistance navigating the unemployment system. We are doing extensive outreach around housing and trying to let folks know that they can't be evicted from their homes right now, but certainly we have a serious concern about the wave of evictions that that could happen and will happen once the moratorium on evictions lifts, right? If people are losing their jobs and simply don't have the resources to pay the back rent, a lot of people could be out on the street. You know, we're also sort of facing the challenge. We run a lot of programming for children after school, and you know, facing the challenge that many of our kids may not have the same access to technology as other families may have, and that language is a barrier for many of our children, and so their parents may not be able to provide the type of assistance at home with the homeschooling that needs to happen right now. I'm a parent, and I can tell you it's pretty difficult to be homeschooling your kids through this time. We also have a real concern about the mental health impact on everyone, really. It's such an incredibly stressful time, and even more stressful for people who are already dealing with a lot of struggles. And we're beginning to think about the impact on the small business community. The Ironbound has and has always had a really thriving business community. And clearly this, you know, this is going to have an impact for them as well. So we are, you know, strategizing on a fund and how we can begin to provide resources to our families in need, in particular the undocumented community. Hello?
Oh, sorry, I muted myself and was giving a speech. Thank you so much for that, Vicky. I appreciate
Sure.
You taking some time. I'm just going to look at the questions here to see if folks have anything specific. There is one question on Head Start funding. Is Head Start funding going to continue for the length of the shutdown? Childcare funding from the state, pre-K, et cetera. Can you talk a little bit about that?
Yeah, so we've been looking at all of our funding sources individually. Certainly all of the contracts. Head Start is confirmed to continue, and all of our Head Start are working remotely, very actively connecting with families and you know, providing lessons and interactions with children and families remotely. So that is definitely continuing. I think where we're concerned about the sustainability of our programs, you know, as it relates to early childhood, is that we receive funding through the food service program, through the federal food service program. And so if we are not operating that, which we are not operating right now, that will have an impact for our budget. You know, we're all around looking at like a 6-month outlook at this point, because we really can't predict how far this will go. You know, I have, you know, to some degree, we're fortunate that we have a cushion, but I'm really concerned about, I'm glad, Maria, that you raised this, this with the mayor about resources for the nonprofit community, because I don't know that, you know, I think there's a lot of organizations that might not get through this, right? Smaller organizations that may not have a cushion. And, you know, it's a really scary time for nonprofits who are mobilizing to provide support and at the same time are trying to figure out their own sustainability.
Thank you. Are there any other questions? I'm not seeing any questions oh, I'm seeing another question just came in. And this is on after school programming. So is the state providing funds on after school programs, or are those funds also on hold or ceasing based on this?
For right now, we understand that Program for Parents, which is how we run one of our programs, that funding is continuing. The other funding source that we have for after school programming is through DCF and the family friendly funding. They also fund our family success centers, which is a really important connection to the community that we have not gotten any guidance on in terms of whether or not that funding will continue. So that is certainly a big question mark for us in terms of the sustainability of those programs over the next weeks and months.
Okay.
But we are, if anything, there's a greater need now than ever to try to support kids at home. It's really, I think, a question of the equity, right? I made, to use my kids as a comparison, right? They each have their own, devices that they can use to do homework. I'm here to help them. My husband's here to help them. And a lot of kids in our community may not have those same resources, certainly. And our staff is really doing the best that they can to mobilize and connect with those kids virtually and coach them through their lessons. I think the question of learning loss is something we should all be thinking about. And the reality is for kids in our community, the learning loss will be greater than it might be in a middle income or high income community. So that's certainly something to keep in mind. They're going to have, I think, even a bigger, harder time sort of catching up, if you will.
Great. And actually, a question has come in that I think would be good for both Vicky and Amina, and that's around mental health support. So Catherine has put in the web chat that there is a state hotline, which is 877-294-HELP. But do either of your organizations have ability to connect people to those resources during this time? We know that that's a critical need for folks.
Well, this is Amina. For me, a lot of the agencies and the partners that we work with are really they're working from home. They're working remotely, and so they're able to do what they can via email and phone. But we can't send anyone to an actual office. It's just not working. And the couple of offices that are open that are attached to government agencies are being overrun right now. So it's been a little challenging.
We have a hello.
We hear you.
We hear you.
Okay, sorry. We have a part-time mental health counselor who is primarily designated to work with our domestic violence program participants, and certainly they continue to work. I think that there's certainly a demand for it. We have been sharing the state helpline. I was thrilled actually to see it come across this weekend. Whether or not people are accessing it, I think, is another question, right? I think a lot of times this is about trust and sort of trusting who's referring you and knowing the person, being able to communicate ideally in your language. So the helpline it fills a gap. Is it for everyone? Probably not. But it's great that it's available, and we're certainly sharing it.
So this is Ron Chaluisan at the Trust. So we've been working with the providers that we're working with our schools to facilitate ongoing counseling for any of the students that were receiving counseling services through either video conferencing or teleconferencing. They're doing both. We're pushing and trying to help get them to the place where they could do both the individual counseling and the group counseling that they were taking care of. The other thing we're exploring, and someone mentioned this prior, I think teachers are really having a very rough time at this point. They're being asked both to be really good parents to their own children, and on top of that, take care of either anywhere from 35 to 120 kids and their families as they reach out to get support in some of the assignments and just guidance. So we're looking to see if there's any way that we could provide opportunities for, either peer counseling or, for teachers. That still, we're just trying to figure that out. And then on the parent side, our parent workshops that we facilitate with Abbott Leadership Institute, we're looking to take that entire series online because we have around 16 parent trained facilitators. We're actually, Stephanie's having a meeting today with Kalina to see what we could arrange to help parents have spaces for them to come together virtually.
Thank you. So Lisa Block is also offering, if you'd like to contact her, and Healthcare Foundation. She's saying that there are mental health professionals working virtually. So we could definitely facilitate some introductions after this call. I know that there are several organizations that that are working on this and that have also reached out, even in terms of the school district. So that's something that we could put our heads around a little bit, I think, and even possibly a topic for one of our future calls is how to support some of these wraparound needs of students, including social, emotional health, mental well-being, their families, etc. It's obviously something that even Dr. Rogers brought up last week in terms of an issue that we're going to see when folks are staying at home for a long period of time. So I want to thank
Kevin.
Yeah.
Hey, Kevin, it's John Pearson from Horizon. Just on teacher commentary, through Horizon in our state health benefits program, as some may know, that's one of the largest accounts that we have, boards of eds, teachers, and through our digital platforms, we're able to deliver a lot of services to our members. Obviously, you have to be a member of Horizon. But we have about 650,000 individuals covered on their state health benefits program. I can certainly come back to you and Maria, provide an update regarding school districts and how we're supporting our teachers and folks that are covered through that program. We're providing mental health services digitally, as well as telemedicine and other services that we're providing. And that holds true to all of our customers, from individual, whether you're getting your product through the exchange, off exchange, Medicaid. We have about 1 million Medicaid customers, small businesses up to national and jumbo accounts. So I can come back if you'd like and share any of those resources and try to push them out. We're doing a lot of that work. Our chief medical officer is really pushing out as much as he can, and all of the other folks within the company's healthcare management area. So working with provider partners, physicians, et cetera. So it is a challenge. I mean, I think a lesson learned for everyone, the digital capability is good, but it's not where it needs to be, given where we sit today. So please let me know if you'd like that and can push it out to your constituents.
Sure, John. If you want to send that information to me, we can definitely make sure that that's shared with everyone. So I want to thank Amina and Vicky, both of you, for taking the time. We are obviously very interested in hearing about what's happening on the front lines with our nonprofits, and always have nonprofit support in our mind, whether it's with the community fund that we're raising or some efforts that the city is putting together. But thank you so much for providing your insight to us today.
Thank you. And I just also want to say, we've gotten so many calls from funders already, and I'm just incredibly grateful for the flexibility that we're not even asking that you're offering in terms of your existing funding, and understanding that we may need to use the resources differently. It really makes a huge difference, and it gives us some peace of mind in terms of knowing that we have that flexibility. So I thank you for that.
Great, thank you.
I would definitely want to echo those sentiments. Thank you so much for everything. Your consideration and support means everything, not only to us and our agency, but to all the people that we serve. So thank you.
Thanks, Amina. And I think that's actually a good segue, because I think we were going to go to Irene next to talk a little bit about the funding response. And I know I did send out a link with my email to a commitment that the Council on Foundations had put out recently. And I know Irene wanted to talk a little bit about what the Victoria Foundation is doing with their grantee. So Irene, do you want to go on now?
I will. Can everyone hear?
Yes.
Good. So I just want to acknowledge Vicky and Amina. We're hearing what life is like for our executive directors on the front lines. Many of us on this call also are homeschooling children or caring for elderly parents or having other difficult situations because of this COVID-19 pandemic. So I just want to acknowledge that you know, we all need to stay well in order to lead our foundations during this crisis, and try to stay abreast of a really rapidly evolving situation, which is can be very stressful and also really important, so that we make, you know, effective decisions. So Kevin thought it would be helpful if I would share with the broader funding community where Victoria is. Where, as most of you know, we are place-based in Newark. Our mission is primarily Newark-centric. So I will share what we're doing. We certainly did sign the pledge that was attached to the invitation from the Council on Foundations. But I'll start with very quick. You know, we have out-of-cycle capacity grant making, and our board within 6 hours, we were able to get our trustees to approve $1 million towards relief efforts. 500,000 of that is for the Community COVID-19 Fund at the United Way. That really feels like the one of the smartest places to support. I encourage all of us to go quick, go large. The needs are just going to get greater and greater over the next several weeks. And so we were able, in that 500,000, knowing that several of our grantees are really particularly stretched and out of supplies, we did a carve out to get, actually today, checks are going out to Newark Emergency Services for Families for $75,000, the Ironbound Community Corporation for $75,000, $25,000 to the Newark Y. They're actually having issues. They have babies in their midst who need, along with the food and the toiletries that they need for all of their population. They also need diapers and baby food and baby wipes, and they need that sort of desperately. And then $25,000 to Bridges, which is figuring out how to deliver meals to the homeless in a situation where you cannot congregate. Those numbers are, I mean, all four of those institutions need more than what we've carved out. So it's not like they're all set. So I want to make sure that we understand that the needs are much greater, but at least we'll get some dollars very quickly, which was important to our trustees and to these organizations. We also have permission from our trustees to use up to $500,000, which is part of our donor advised fund. which sits at the Community Foundation of New Jersey. And that $500,000 can be used in emergency response for this pandemic. The idea was for funds to get really into like the grassroots needs on the ground in Newark, where perhaps the bigger community fund may not reach that far down, because the community-wide needs are so large, medical and food insecurity, but there are lots of groups that will need support, and it's sort of a twofold mission for that second $500,000. One is really for our smaller nonprofits to understand what their needs are to attempt to be sustainable during this crisis. To that end, we're actually sending out a very brief survey. We were actually able to participate in the Center for Nonprofits survey from a week ago, where we got a special link for Victoria Foundation, and we got some early information from about 95 Newark nonprofits and what their immediate situation was. But that was an anonymous survey. So we're sending out to our grantees. We have 150 nonprofits that serve residents in Newark, and so we're sending out a anonymous survey to those folks, and we're asking 3 questions. How, basically, this is similar to the Center for Nonprofits. How has the COVID-19 pandemic affected your operations and programs? How specifically, this is number 2, has the COVID-19 pandemic affected your finances? And number 3, how might philanthropy be helpful to your organization at this moment? So if folks on the call want to, if you would like me to share the data that we get from this grantee survey, I'm also happy to do that. And I'll let our grantees know that that's a likely scenario. The other piece for that second 500 is for real grassroots advocacy, grassroots organizations that are really going to struggle. It's also for figuring out how to help the gig economy and the creative economies in Newark. People who are self-employed. These are groups that may not have access to even that small business fund that requires, it is intended for very small businesses, 2 to 8 employees, but there, as we know, lots of folks that even are a rung or 2 below that bar that we want to try to figure out how to help. And then again, as Vicky mentioned, we want to see what we can do to support our undocumented residents. So that's the second 500. The other thing that some of you may know is over the last couple of years, we've been doing some neighborhood-specific work in Newark, and we have 2 target neighborhoods, the Clinton Hill neighborhood in the South Ward and the Fairmont Heights neighborhood in the West Ward. And the notice that went out from City Hall 2 days ago indicated that 2 of those 3 hot spots that the mayor mentioned are those 2 target neighborhoods. So we have a separate fund. It's part of, we call it a Thriving Neighborhoods Initiative, or TNI. That's $400,000, which also lives at the Community Foundation of New Jersey. And we're trying to understand what the very specialized needs are of residents in those neighborhoods, so that we can respond as well with that other pot of money. I also wanted to share what we're doing with our grantees. So in December of 2019, we sent out about half of our grant checks to about 75 grantees that are in our portfolio. And those funds are intended for calendar year 2020. We are about to let those grantees know that we are not, that we are converting those grants to general operating support, and that they will not be held responsible. We're basically releasing them for any benchmarks that we agreed upon when we sent those checks out. We're doing the same thing for our upcoming 2020 spring grantees. We are letting those grantees know that, again, we are converting these grants to general operating, and they are released from their benchmarks. We're also releasing our grantees from sending us grant monitoring reports and financial reports. And we are going to expedite those spring 2020 grants. That's the other half of our grant making. We have 2 cycles a year. Typically, those grants would go out at the end of May because the grant year would start June 1. And we're going to get those monies out as quickly as we can. To that end, I wanted to let the funding community know that we are working with our banks to get a line of credit. We're exploring, I should say, a line of credit for up to 2 years of grant making and operating funding, maybe about $25 million. The reason we're doing that is because at some point we hope that when we are past the danger, that the markets will will rebound, and that we don't want to use all of the we don't want to spend the money in our corpus that then cannot have the opportunity to rebound. So we are looking at potentially paying out for some period of time our grants and our operating expenses through a line of credit. And the last thing I wanted to share is that we have, for our Newark grantees, a modest partnership with New Jersey Community Capital for a very low-cost line of credit program. We basically buy down the debt so that it's at 2%. For our grantees. There's only 8 right now of our grantees in this program, and we've been in conversations with our friends at New Jersey Community Capital to significantly expand this program, to try to expedite the time frame that it would take for our, particularly our smaller grantees that are going to be hugely impacted by COVID-19. To get them up to between $50,000 and $100,000 in line of credit to help them sustain themselves through this crisis. We would again buy down the debt. We would also guarantee some of that money. We want to also relax some of the payment requirements. Maybe have some months where no payments are required, and we're working with New Jersey Community Capital to greatly expand this line of credit program. If there are other funders on the call today that are interested in joining forces in this program with NJCC, please let me know offline, and we can figure that out. So that's sort of where we are at the moment. We're trying to be nimble. I'm blessed that we have processes in place to get monies out the door really quickly. And I'm also blessed that we have trustees who are willing to really step up and make large contributions, even while we see a 25 to 30% loss on our corpus. So I'm just feeling very grateful for those realities at Victoria Foundation.
Great. Thank you so much, Irene, for all of that and for the Victoria Foundation stepping up in such a big way. It's obviously much appreciated, and those dollars are just so critical quickly, as you said, with what we're seeing on the ground changing every day and just so many basic needs required. So I do want to now go to Catherine Wilson, who can give us an update on United Way funds, as well as I think she wanted to talk a little bit about the food situation, and then I can close us out after Catherine.
Thanks, Kevin. Everybody can hear me, hopefully.
Yes.
Still learning this new technology over here. So first I want to say thank you so much to Victoria and Prudential, who were the first two funders into the fund with large contributions. We've had a couple other funders come in since that initial funding. So right now on the community fund side, we have about 1.175 million. Which is a great start, but it's clearly not enough to really get a handle on the needs right now. On the small business side, as the mayor mentioned, there are different streams of funding on that side for small business, but ultimately the city will be putting in $2 million, and we believe on the private sector side, Prudential will be putting in some money as well. At this point, we're still seeking additional funding on both, and we hope that folks will continue to make large contributions as they are able to. Just two other things I wanted to talk about. I do want to talk about the food situation, but before that, I want to say I was able to speak with Senator Booker yesterday for about 30 minutes. I want you to know that I did advocate for the relief for charities. And that he has ensured me that all of the resources that he has with his staff, he is willing to assist United Way in the community in getting this coordination moving. So let's talk about food for a second. I would say that of the greatest needs in the community, what we're hearing right now is food being the number one. Obviously, from our nonprofit partners in the social sector. Obviously, the second issue is the small business needs. We're going to lose some small businesses if we don't act quickly on that. And of course, as everybody knows, the third is the needs around public health and getting masks and the right PPE in order for our healthcare workers to do their jobs. Another issue on the healthcare side is, of course, childcare. That's become a huge issue as well. So we're trying to work with some partners on the ground to secure childcare for some of our medical staff. So let's talk about the food. I have had some calls with the community food bank, and I've had other folks reach out to and coordinate some coordination on the food distribution side. One of the issues at the food bank is they have food is coming in. They do have some funding coming in, but it's actually the distribution, the pickup, et cetera, et cetera. So we're trying to coordinate with the community food bank and a couple other providers and intermediaries who deliver fruit, veg, and protein to pantries. And so we are coordinating that this afternoon. And so we're going to tap into our nonprofit partners who are able to distribute food and get that coordination going. The food bank is also putting together kits of food. So for example, they have a kit that has approximately enough food to feed a family of 4 for 1 week. That seems to be sort of the best way to get the most amount of food quickly. So we're trying to source those boxes and how much each one of those boxes cost. In addition to, again, working with some other partners on the distribution side, I did speak to Roger on Sunday. They are, as the mayor said, serving meals at the 16 school sites. They are also distributing boxes of food to their neediest families. And of course, every family we know struggles, but in any event, they are distributing boxes at the school sites to families as well as needed. So we are in the process of getting that coordination underway, and we'll continue to do that with all of our nonprofit partners on the ground. But again, the support continues to be needed in order to do that. So that's all I have at this point, and unless there are any questions.
Catherine, it's Marcia Atkins. This is not a question, but I just want to make sure you know about Table to Table, which also distributes food.
Yes.
Okay, good.
Got it. We've talked to them. Yep.
Thanks, Catherine. I really appreciate you taking the time. I would just say, in terms of the greatest needs right now, and just hearing from the city side and the mayor, I think what Catherine talked about is dead on. But I think on the general community fund side, it's really about food. The mayor is very anxious about providing food to families in the affected areas, in these cluster areas. So they're working with ShopRite on providing families with gift cards. They're exploring some other things as well to get food to these families, but we're really trying to get as many funds as possible to that effort now. So anybody who's interested specifically, on the food side or on learning more about the food side, please contact me, because that's something that the mayor is very anxious to get started as soon as possible. It's actually starting today with some early funds to get folks food. And then the other thing is obviously the small business fund, and I think that's a good opportunity. So as Catherine said, the city has committed $2 million. It's being announced tomorrow. And as the mayor said, on Friday, there's going to be a webinar available for small businesses in the city. But we're doing active outreach to particularly our financial institution partners to see if they would be willing to provide some level of matching funds for that small business fund. I would also say it's likely at some point that the city will do more on the community fund side in terms of supporting nonprofits, social service organizations, individuals. So I think there are good leveraging opportunities of public dollars here for both of those funds, because it is all definitely being explored and considered. One final thing, Margaret, if you're still on, I don't mean to put you on the spot, but I know that the Community Foundation officially announced the statewide funds today. I don't know if you just had a couple words about that, or maybe it's too early and you could just tell us that too. But I don't know if there was anything you wanted to say about that.
Sure, I'm happy to offer what I know. I haven't been deeply involved in the planning, but it went live today. You can go to www.njprf.org. There are a lot of New Jersey celebrities or well-known people who have done a video trying to encourage people to stay home and to give to the fund. We've already started to see money flowing in today. And the money, there's 7 right now. There's 7 board members. You can see all that on the website. They include Andrea Jung, Nina Wells, our former Secretary of State, Ray Chambers, Laura Overdeck, Ann Unterberg, and one other one. I don't know. Josh Weinrich, who's from Summit, is actually the CEO in charge of the fund. They're going to be working together with us on the grant making. They will be doing the grant making as an advisory board. And we're just going to support the initiative and the effort. It's meant to be statewide. It's really meant to fill in the gaps where support isn't coming in from other sources. And it's all being, created and developed as we speak.
Hi, this is Maria. If I could just say something. Thanks for that, Margaret. I was talking to Hans about this because I knew it was coming out. Possibly when we do another check-in,
sure,
perhaps it would be great to have the gentleman that's in charge that you mentioned possibly come in and just kind of give a report about how things are moving with that. I think it's going to be important to figure out ways to coordinate services so that we complement and fill gaps as opposed to run into, really map out where the needs are and how to best distribute dollars.
Right.
Okay.
I'm sure that would be terrific. I think the idea is that this is a statewide fund across the board. And so obviously we've got some constant work going on here in Newark with the fund that Catherine is managing and people are giving to. And obviously there's going to be need across the whole state. And that is, I think, what the First Lady had in mind in setting up this fund in the first place. So yes, I'm sure there'll be a lot of coordinating of effort going forward. Mm-hmm. And I'm happy to pass that message on about asking Josh to join the call, perhaps in a week or two when we do this call next.
Right. So what I also wanted to add to that is, that the CNJG had a meeting recently where we looked at other funds that are being set up. So possibly one of the things that could happen is that one of those check-ins could be a statewide check-in that includes Newark, but would also include the Central and South Jersey where there's
Right.
work underway.
Right. I know you guys had the meeting last week. I think the statewide one wasn't really ready to roll yet. So there you go. But
Yeah,
I'm sure that can happen. Sure.
exactly.
So I want to thank everyone for joining us again. We'll continue to do these calls weekly, and we will continue to have folks from various angles of this crisis. So we really appreciate you joining us. As Catherine and Irene said, please continue the conversation with the United Way about the two funds that they are housing. There will be news tomorrow on the Small Business Fund. And then the final thing I will mention is for those of you who participate in my Thursday morning 9 a.m. calls, we're going to really focus that on some funder coordination this Thursday. So I'll send a special email on that, but it's not going to be a typical call. We're going to really focus on some coordination efforts. So I will send more details on that as well. But with that, I think I will close us out today. The call was recorded, so if anybody missed any part of it and wants to go back, you can feel free to do that. Feel free to reach out to me or Catherine with any questions, and we will speak to everybody next week. Thank you so much for
Kevin,
Yes.
can I interrupt you? It's Marcia. One more thing. We didn't discuss at all today the needs of the hospitals and the health centers in Newark and more broadly. And I think that we should be discussing that as well. So I'd like to put that on an agenda for a future meeting.
That's a good idea, and we could probably even do that next week. So thank you.
Okay, great.
And I say Aaron asked about that too, so we can definitely make sure that that's a topic of conversation next time. Thank you so much, everyone, for joining us. We will talk to you soon.
Bye-bye. Thank you.
Bye. Thanks.